So, Jason, thank you so much for taking time to be with us. Could you just describe your title and your context where you serve?
Sure. So I serve as the senior rabbi and the director of the spiritual care department at Cedars-Sinai Medical Center in Los Angeles, which is actually a health system. So we have a main campus, and then we have 3 other hospitals where we provide chaplaincy.
Great. So when you think about because it's vast, right? The landscape across which chaplains and spiritual care providers are serving within healthcare context, it's a huge landscape. If you think about what are the things that educators and trainers most need to know in preparing amazing candidates for serving in these roles, what do you think are the top priorities?
I think that we're often looking for candidates that have a good combination of both being very well grounded in a tradition, in an approach that they sort of feel like, okay, I have been trained, I understand where I'm coming from, I'm anchored, I can advocate for this approach. And then they can be really great chaplains for patients who come from that same tradition, or they can, understand what it means to have a tradition, whatever that is. But at the same time, this is where it's hard to be able to be very well grounded in a tradition, but also be able to be flexible enough to be there for people who do not share that perspective. And so and it's complicated, but if people can be trained to both, be firmly grounded in their own tradition, but not so much that they're fundamentalist about it, such that they can't be there for someone else who does not share their perspective.
When you, considering this importance of both having a chaplain with a grounding in their own particularities and in their own tradition, and the ability to empathize and see and walk alongside traditions that are very different than theirs. So given that, when you look at candidates' CV, or where you're looking at sort of what their sort of how they're presenting themselves, what are the aspects of their training that you tend to say, yes, that, or that's not quite as pertinent here?
So obviously, when looking at a resume, there's the basic things that we're looking for, the basic training. But personally, something that I look for is either if they've had, real world experience, or if they have developed some sort of expertise. So for example, in a training program like a theological school, an ordination type of program, or a master's of divinity, or, oftentimes people are given some kind of a capstone or a thesis project through which they can develop some kind of expertise. And for me, it's valuable both because it's wonderful to see that someone has something that they really excel at and that they have an expertise, and that can be an asset. And I also find that the more a person develops an area of expertise, the more that they can be respectful of other people's expertise. So, for example, a chaplain that shows up at a hospital that has an expertise in some kind of field of theology, when they speak to a clinician, a doctor, or a nurse who also has an expertise, there is that sense of respect for that area of expertise. So sometimes it takes that opportunity to learn something in a deep way that helps us to recognize that there are many different areas that require that, and it can give us a humility that is essential to chaplaincy.
That is so helpful, and such a clarifying perspective in terms of the value of expertise development. So would an example be, say, if a student has, for their capstone project, they have said, trauma-informed practices is really their thing, and here's how they've done it. What I hear you saying is that it's less important that they show breadth in knowing everything than that they have the foundations, that they demonstrate the ability to be able to navigate across traditions, but that they also have demonstrated that they've gone deep in some areas.
Yeah, to me, the depth is more important than the breadth, except as long as they can show an ability to be flexible and be creative, as I mentioned before. So if I see that a candidate has a depth in a certain area, as long as I can feel like, they can't only work in that area, because then that would be limiting. Because then I'd be like, okay, only if I have a job that is that expertise. But if I see that they have, whether it's been through an internship or some area where they've shown like, look, I have experienced a lot of different things. I'm willing to learn new things, but I also have delved deeply into one area. So that to me is a really great asset.
So Jason, imagine that you are sitting with other colleagues who make hiring decisions about chaplains in healthcare contexts. When you all are talking about programs that are training chaplains, be they theological education institutions, CPE programs, what are you, as you sort through, yep, they're doing a great job over there, or that one's having some challenges, or really could have some improvements. What are some aspects you think about when you're making those, having those perspectives?
I mean, definitely I would say, some programs have reputations for being great places of training, especially because of feedback that their graduates share. A lot of times that feedback has to do with their ability to participate in their learning, meaning if they can create curriculum or internship opportunities or different areas of focus. A lot of times we hear the best feedback where students get to be leaders in the process of their education. Because we recognize that each student is different and learns differently and has different interests. And the more they're able to kind of adjust and focus on those interests, we find the more they get out of it and the more they grow.
Thank you so much, Jason, for your time and for sharing with us the perspective from those who make the hiring decisions about chaplains in healthcare settings and the training and education that's most valuable.
My pleasure. Thank you for all that you do.